Good evening. My name is Bharti Nathani. I am practical nursing Durham College student, semester 2. We are doing a midterm critique for a simple dressing with sterile gloves. My student ID number is 100762282 and get started. So first of all, we'll check doctor's orders. Here I have doctor's order that says it's for patient Sid Garland and date of birth is November 8, 1965, allergies codeine and penicillin, and the order says that cleans wound with normal saline, apply simple dressing to wound and change dressing every 3 days, Dr. Jones. So now I have my worksheet. I'm just going to enter everything in my worksheet and make sure I write patient's name, Sid Garland, November 8, 1965. And codeine and penicillin are the allergies, and MRN number is 344316. Next step, I'm just going to put this in my pocket so I can check with patient. And now I'm just going to put this away. So now we'll do the hand hygiene first. I'll gather the supplies. So I'll need one pair of clean gloves, one pair of sterile gloves, one 2x2 gauze, one 4x4 gauze, and one abdominal pad, dressing tray, sterile dressing tray, tape, and the normal saline solution 0.9 NaCl. Expiry date says January 2021. I checked, so it's good to use. We can use this. And next, I'm just going to gather the supplies and get ready to enter into the patient's room. So before we enter, we'll make sure we do again hand hygiene. And ready with the stuff. Good morning. My name is Bharti and I'm a practical nursing Durham College student, semester 2. I'm here to do your dressing change. Is that okay with you? So take the consent from the patient and then I'll check the ID. Can I have your name, please? Okay, Sid Garland. Okay, yeah, that's what I have. Can I have your date of birth, please? November 8, 1965. Allergies, codeine and penicillin, perfect, and MRN number 344316. I'll check your armband also. Sid Garland, November 8, 1965, MRN 344316. Allergies, penicillin and codeine, perfect. I have a right patient. How are you doing, Miss Garland? Do you have any kind of pain? Do you want to use the washroom? Okay, so we can do the dressing right now. So Ms. Garland, what I'm going to do is I'm going to do the quick environment check and then I can do your dressing, okay? So we'll do the quick environment check. I'll make sure that the bed is in the lowest position. Side rails are up. Bed brakes are engaged. Oxygen and suction level is working properly. No clutter around the bed and call bell within reach. And for patient's privacy, I'm just going to close the curtain so we can get started. Okay, Ms. Garland, so I'm just gonna prepare the sterile field so we can do the dressing, okay? And I will answer, if you have any questions, concerns, I can answer once we are done with the dressing. Perfect, thank you. So what I'm gonna do is, I'm gonna do the hand hygiene and get started. Open the dressing. Ms. Garland, is it okay if I put this garbage bag near your bed, just at the toes of the feet, not too close? Thank you. And now I will open this. So we'll just touch the 1-inch border. Grab the okay. I'm only supposed to touch the 1-inch border, and now I'll just move this top so it's easy for us to. Okay, so just move the tray here closer, drop here, and this is the garbage bag. You can keep it here. Okay, and I'm just going to put this forceps on the sides, and I will add 2 by 2. I'll just tap a little bit back, and now I have my abdominal pad, and goes right here. Okay. What I'm gonna do is I'm going to open the garbage bag so it's easy for us to put everything inside. Okay, so now I do put the normal saline. So we will check normal saline 0.9 NaCl, expiry date January 2021. I'm just gonna hold it with the towards the label so we don't make it wet. So I'm just going to open it. Lid gonna be upside. I'm gonna just lift the solution a little bit, and then we're just gonna pour into our tray. That's it. And I'll just close and okay, so it's all good. You can see. Now we have the sterile wheel ready. I'm just gonna wear my clean gloves and remove the dressing. Okay, so we'll make sure that we loosen the hair, okay? And so I don't have the other one, so okay, so away from patient's face, and there's no discharge here, so we're just gonna, it goes in the garbage. Now I will take the transfer forceps and see the 4x4 gauze, and I do see here it's light pink, mild serogangrenous discharge, and it's a very mild. And the 2, it goes in the garbage, and this forceps goes in the garbage. I'm going to remove my disposable gloves and do the hand hygiene. And now what I can do is before we clean the wound, I will wear the sterile gloves. So sterile gloves, I cannot leave my sterile field, so I'll just make sure I do it here. We can only touch the 1-inch border. My right hand is the dominant one, so I'm just gonna wear it with this. And put the under the cuff here, and then wear the other one. So I'm on with my sterile gloves, and now we will clean the wound, and then we'll dry the wound. So we'll get started with that. Okay, sorry, I forgot one step here. Before we get started, I'm just going to put the drap. So here I have a drap, pre-drap on patients. Okay, perfect. So the drap is on, and now I will clean the wound. So we'll take 2 by 2. Make sure I squeeze enough water. And I'll clean middle, top to bottom. And we'll take one more 2 by 2. We're gonna do the same thing, repeat the procedure. Easy. Distal, top to bottom. And proximal, top to bottom. Now I will take the dry gauze and dry that. Same thing, middle, top to bottom. Distal, top to bottom. And proximal, top to bottom. Okay, so I can keep this here. And now I can see, we will do the assessment of the wound. I see that it's a little bit red and inflamed, but which is a good thing. She just had her sutures 2 days back, and the skin is intake and sutures are intake, and I see that (21) sutures all intake, and we already noted the discharge, which was serosanguinous, like pink discharge. Now we will do the dressing. Okay, so yes, I'm gonna put 4 by 4. So we're just gonna put 4 by 4, and just gonna put this abdominal pad. This blue line should go up. So yes. So now we are done with the dressing. I'm just gonna remove my gloves. And I'll intake the dressing. So put the tape. Okay, so now I forgot to mention 2 things here. When we started our table, side table has to be about the waist level. Same thing for the bed also, it has to be about the waist level, and hence all the time above the sterile field, so that it's not contaminated. Now we are done with the dressing. Dressing is secured properly. Now I'm just going to dispose this in the biohazard, and this metal forceps goes in the sharp containers, and I'll just clean everything. And after this, I'm going to document the at the time, like 19-30 hours I did the dressing, type of the discharge, that was a serosanguinous mild to moderate discharge, and skin was intake, peri wound area was a little bit red, and 21 sutures intake, and patient tolerated very well, patient's response also. And once I leave, I'll make sure that the bed is in the lowest position and cold bell is within reach, and I'm just going to clean this. Thank you.